Record. We're going to begin with me. I'm your instructor for OB. I've been teaching OB nursing for several years now, for Fortis in particular. So I'll be your instructor for this class. And what we're going to do today is we're going to I'll share with you some objectives. So for as far as I'm concerned, I graduated from Ohio State in 1985 with my bachelor's in nursing, because I was raised in Ohio, born and raised in Ohio. So I'm a true Buckeye, even though I've lived in other states. I've lived in Florida for a while. I've never been to Port St. Lucie. But I hope you all are faring well from the recent hurricanes. I do have family members down there. I have 2 children down there, and my ex-in-laws are down there. So my sister-in-law's down there. So a lot of family members down there that all did okay, thankfully. But and then most recently, I moved from Tennessee to Michigan for cooler weather, and that's where I reside now. I worked in Ohio at hospital and moved to Florida and continued. I have a varied background in all kinds of nursing.
I'm trying to
and
see
then
if I know anybody that's in the class.
Miguel.
I just see Owen. Oh, I see Jenny, David. Okay. Yeah, you want me to give you the code? Yeah. It's 3-1. It's 3-4.
Miguel, is your last name Zatina? Are you?
Yeah, so
are
3-4.
What's the meeting ID? That's on the.
Yeah, that's the meeting ID, the one I'm about to give you.
All right,
I'm going to mute you, Miguel. Okay. Usually the first week or two in our class in the online nursing is a little confusing, trying to get everybody at the right place. But anyway, I practiced as a registered nurse for quite a few years before I went back to school. So when I was living in Tennessee, I went to Vanderbilt and got my master's and my doctorate in women's health, and have been practicing as a nurse practitioner until I started with Fortis in 2019. When I was living in Tennessee, I taught at the Nashville campus. And I know I've got several Nashville people here today. I taught the maternal OB, pharmacology, and health assessment.
No, you to the call me, give me Zoom code.
Okay. People are signing on a little late here. All right. So we'll get it all straightened out. And so, and when COVID broke out, Fortis had to design an online program. And I was part of the groundwork for that, helping to develop the maternal OB program. I no longer teach anything else but OB. I teach this class. I teach a Friday morning class, the same thing. And then Wednesday afternoon, I have a class. So all 3 classes are the same exact thing. But I enjoy what I do, and I welcome you to this class. This class is a turning point in your nursing education, because most of you are either taking Med-Surg 1 and pediatrics or pediatrics. And so it's a heavy load this quarter, because you've got 2 classes that require clinicals and simulation. So you're very busy. Okay, so that's why this is probably the most difficult class, the most difficult time in your education. So it's really important that you're organized. Okay, success comes from planning. Okay, planning ahead, what you need to be focusing on, set aside time, and we'll talk about that today. So we're going to go through an orientation. Let's see here. So we're going to go through an orientation for about almost an hour, and then we're going to jump into some content. anytime during the next couple hours, you can interrupt me. Okay, please do. If you have questions, you need something clarified. So today what we're going to do, we're going to talk about our structure in online nursing, our platforms in particular. So Canvas, ExamSoft, those things. We're going to talk about those. And we're just going to talk about what is the online class. We're different online than what you've been used to on campus or any other online program, because now you're in a 200 level class where our standards are more strict. So make sure you're paying attention. We're going to discuss the syllabus briefly, the Canvas structure, and then we're going to talk about beginning some drug cards and which drug cards to begin. And then we'll go into week 1 concepts, chapters 1 to 3, and what assignments you need to get done by early Monday morning, and then dating your Canvas attestation. Okay, so those are the things that we're going to try to get covered today. Anybody have any questions right now?
Yes, I do. What is date attestation mean? Like, what do we have to do for that?
So every week on your Canvas module, because you have a module in Canvas. I don't know if you've looked at your Canvas. Have you looked at Canvas?
Yes.
Okay, every week you'll see a module. At the very bottom of the module, it says attestation. And the only thing that is, you click on that link and it takes you to a page that says quiz. And the quiz is simply putting the date in. It's not asking you questions. You're just going to date the day that you attended class. So for example, click the link and put today's date in. If you did not come to class, you can't do this. Yeah, you'll get a 0. Okay, so don't put anything in. If you attended a different day for various reasons, you'll put in a different date. You'll put in the date you attended. So let's say you normally come to class at 3 o'clock. You decided that day you had something going on and you wanted to come to the 9 o'clock class, and I gave you permission, then you're going to put that the same date and you put 9 o'clock. If you attended a different instructor session for some reason, there's let's see, 1, 2, 3, 4, 5, 6, 7, 8 of us. If you attend one of their sessions because you can't get to any of mine, then you put the date in and the instructor's name. Okay, I can give you some guidance with that later. So that's what we mean by attestation. You're
Thank you.
testifying to be in here. Yeah. Anything else?
So Penny, are you saying that we can be in a different time class? I mean,
If
at a different time, well, if we had permission?
if you have permission from me, if you
Okay.
have something going on, some kind of prior obligation, or you have a sick family, or you're not feeling well, and you ask me, of course, this is Friday afternoon at 3, that's probably not going to be a reason. But if you had something else you needed to do and you want to attend Wednesday or Friday morning, you need to ask me ahead of time. Yes.
Okay, thank you.
You're welcome. Anybody else? Okay, so as I talk today and we have our little discussion, you can interrupt, it's fine. So once again, welcome to the October session of Fortis. And I know what campus everybody's from by looking at your introductory discussion, except for Miguel. And are you scheduled to come today, Miguel, on Friday afternoons? You're muted.
Yeah, I am, I think.
You think? Okay, I need to double
Mhm.
check that because I didn't see. I think I saw your name at one time. Okay. And then is it Aldane Jameson? Are you here?
Yes, ma'am.
Okay, what campus are you from?
The Port St. Lucie campus.
Okay. And then Owen, what campus are you from? Owen Johnston.
He's from Port St. Lucie also.
I'm from Port St. Lucie. I'm sorry, my mouse is messing up.
Okay, great. I got that. So everybody, most everybody, but those two have signed in their introduction to let me know who you are. So I know most of you are from Port St. Lucie. Okay, some of you are from Nashville, and then I have a couple Cincinnati students. Okay, so online courses. There's a huge benefit to online learning. You can be at home. You can be comfortable at home. Save gas instead of going to driving to the campus. Save time. But then there are certain disadvantages. I can't see you all the time. And sometimes I can look at a student and tell whether they're confused or distracted. So there's some disadvantages. So it's really important that you stay in contact with me. Okay. Send me a text, send me an email if you need something, if you want some help, and do it often. I find that those who communicate with me often usually do better. Okay. So my job for you is not only help you learn during our Zoom sessions, but also give you some guidance and some feedback of maybe what you're not understanding. Okay. But you are ultimately required to put forth the effort to learn. Okay. I can't just put it in your brain. You have to read, study, and absorb it. So as far as communication with the online faculty, you come to me first. If you have a concern or a problem, reach out to me first. Okay. If I can't answer, I might direct you to one of your instructors on campus, especially if it's a question about simulations. You need to talk to her, him. Okay. Or clinicals. I don't know your clinical schedule. We're trying to improve my conversations and communication with the on-campus, but we've got 15 campuses, and that's kind of hard to always know. Okay. My phone number is here. My name is Dr. Zeller, and my former name was Lamascus, so you might see that name as well. So my phone number is here, 517-745-3815. And you can text on that number, or you can call that number to get a hold of me, or send me an email through Canvas is fine. Okay. If I or anybody, no one on campus can answer your question, then you can reach out to Dr. Darlene Brown. She is the National Dean of Online Nursing for Fortis. And her phone number is on this page. And this is a phone she has just for students. So feel free to text her or call her. And when you do contact her, make sure you let her know you're in Nursing 202 and who your instructor is. So you would say, I am in Dr. Zeller's 202 class. Because she has a lot of, like 1,500 students. So remember, I'm available. I'm your very first contact. I'm also the lead OB instructor for Fortis. So I have 8 other instructors that teach this same course. I would ask you to be professional during Zoom and even outside of Zoom with your instructors, with your dean, with those who instruct you, and your classmates. Respect one another, use professional language. Don't try to spread rumors. Don't start saying so-and-so is cheating unless you have evidence. That really just stirs up strife. It stirs up all kinds of things. Unless you know for sure, please do not do those kinds of things. So because we have a campus in Salt Lake City, and then we have your campus, those of you in Port St. Lucie, we cover several time zones. Okay, so fortunately for those of us in Port St. Lucie, you're in the Eastern time zone, so am I. I'm in the Eastern time zone, but Nashville is not in the Eastern. Nashville is in the Central time zone. So when we talk about due dates and times that assignments are due, we base it on Pacific time. So if your assignment is due at 11:59 p.m. on Sunday night Pacific time, that means it's 2:59 a.m. Monday. Okay, so it's ahead by 3 hours. Okay, so those of you in the Eastern time zone, your assignments for every week are due Monday morning at 2:59 a.m. by that time. Okay, if you're in Nashville in the Central time zone, your assignment will be due at 1:59 a.m. Monday. Okay, that can be confusing for everybody. That's why I like to show a map. So when you have weekly homework due, you know when it's due, except for discussion questions. So you have 5 different discussion questions throughout the quarter. You need to post an initial discussion question by Wednesday at the same time. So Thursday morning at 2:59 for Eastern and 1:59 for Central. And then a response to the discussion is due then early Monday morning. And I will try to, in my weekly announcements, remind you of those things. If you don't get your assignments in on time, in other words, you don't get it in by Monday at 2:59 a.m. and you turn it in Tuesday, your grade will be deducted by 10%. And that can hurt. But still, it's better to turn it in late than not to turn it in at all. If you don't turn it in at all, it's a 0. Okay, so that hurts your grade. Okay, let's see. I'm just looking at something here. Somebody just signed back in with a number 573153. Is that you? What's your name? I don't know anybody yet. Can you tell me your name?
Oh,
Gina?
yeah, Gina. I'm Gina Wickham. So sorry about that. I was on mute.
That's okay.
Nice
Okay,
meeting you,
Gina.
Dr. Seller. Yes, ma'am.
Okay, gotcha. Let me just rename you, okay? There we go. Thank you very much. Okay, now Owen and Aldane, you need to keep your cameras on, okay? And I need to see your face. Okay. I will tell you that if you don't keep yourself on camera and you don't respond to me, I'll give you a few minutes, and if you continue not to respond to me, you don't get credit for being here. Okay, you can, if you're having a technical issue, then you need to go ahead and send me a text and tell me you're having technical. Okay, if you don't respond, I will remove you from Zoom, and then you don't get credit. Okay. All right, so late policy. So get your homework done. It's really important. And as soon as I get back up to where I was, here we go. So we take attendance in this class, not only with Zoom, because Zoom will tell me who was here and will tell me when you sign on and when you sign off. So I can take your attendance that way, but you're also required to do 2 other assignments for the week. Okay, in order to get credit for your attendance. So you can't just show up in Zoom and not do homework. You have to have your homework done by the end of the week. Okay, so if you attend Zoom for 2 weeks in a row and you haven't done any homework, you're going to be automatically dropped out of the class without any notification. So you have to do your homework. There's a reason for homework. Homework is our tools for learning, and they're very important. So you need two submissions. Now, there are some weeks you have more than 2 to do, okay? As far as the attestation, we'll be talking about testifying that you were present, doing that on Canvas. I'm going to show you that now. Let's see, wait a minute. Are they working? I will in there. Sure. They can save you. Okay, one. All right. Trying to get me to use my earplugs there, left ear. So what I'm doing, I'm sharing my screen here. Can everybody see it?
Yes.
I have my Canvas opened up. So at the bottom of week, oh, wow. Man, not while on Zoom. Sorry. Sorry, Annie. Okay. So down here, so week 1 module, you see right here, it says week 1 and then week 2. Down here, it says week 1 live lecture attestation. That's where you click to go in and date that you were here today. Okay. If you don't do it, you weren't here. Okay. It's like, I'm not going to do it for you. You have to do this yourself. Put the date in that you attended. Okay. So my recommendation is that when we're finished at the end of the time with, our 2-hour time, that you do it at that time. Okay. And that's what we mean by, if you don't document, you weren't here. If you don't date your attestation, that means you weren't here. Okay, so success is planning, okay? Planning what is due on a weekly basis. So I recommend that you get a hard copy calendar and you plug in what is due when. You plug in when you work or any other obligations that you have in your calendar and set aside time to study. Okay, Kelly. So if you're having trouble with your camera or something today, hang on after Zoom and I'll work with you on that, okay? All right, so planning out everything, because you should be spending 25% of your time planning. Okay, so this week you have OB calculations due, right? You have your introductory discussion. So you need to plug that in to your calendar. And then next week, what do you have to do for OB next week? And then plug in when you're going to prepare for OB. So the most important thing about planning and success is staying in contact with me, because I can remind you about things. I can help you with your NCLEX questions, explaining to you how they can benefit you. Okay, that's really important. And another really important thing is having a computer that works. Okay, you can borrow one from the campus if you don't have your own, but you need to have a camera that works. Especially for the final exam. Okay, and your internet connection needs to be reliable. If you are dropped a lot, you need to maybe plan on going to the campus during class time so that your connection is more secure. Okay. I want you to check Canvas a couple times a day. Check for announcements, check your email a couple times a day, making sure you're not missing anything. It's just one way of staying in contact with me. Has anybody not looked at their Fortis? I'm sure you have if you've done your introductory, I'm sorry, your Canvas, if you've done your introductory discussion. So we have a syllabus, or you have a syllabus for the class. The syllabus and Canvas are supposed to be the same. If there's any conflict, you need to let me know if you see something. But if there's something that doesn't look like it jives correctly, we need to correct it. But the syllabus is ultimately the right form we need to use. Has everybody been able to access their ebook? Yes?
Yes.
Yeah?
Yes.
Yes.
Okay. Good. If your Fortis email is not your primary email in Evolve, Canvas won't work. Okay, you won't be able to access your assignments. Okay, so if your Evolve is anything but Fortis, you need to go to your Evolve account and change it, and that will give you the access that you need. Okay. Instructors also hold optional Zoom sessions as well, and you'll get an announcement about that schedule. So other than maybe some Kahoot games and case studies, we also offer tutoring. So you can contact me and we'll set up a time together. You and I can get together on Zoom and talk about some things that you don't understand. Okay. Students who do this do really much better than those who don't. So let's talk about grades. How do we grade in this class? Well, there are two components to grading. One is a KGA and the other is homework. A KGA is key graded assignment. These are objective assignments, okay, objective grades. So you have exams, 3 exams and 5 quizzes. Actually, you have more than 5 quizzes. There's 3 more at the end considered assignments. And then you have your final comprehensive exam. The calculation of those key graded assignments must be 78% to pass this class. Okay, so you'll notice in this rubric, you might say, that exams have a heavy weight on your grade. In other words, it's the most important of everything. Quiz is only 5%, and then your final is 20%.
I have a question.
Yes.
Is the comprehensive or the final exam the same as the specialty HESI?
Yes, yes, it
Okay.
is. It's the same thing. Yeah. Yeah. So once that, if you reach a 78% on that, the next step would be for us to calculate in your homework grades. So that if your homework calculation does not reach 78% or does not reach high enough to keep your KGA at 78 or higher, you're going to fail the class. That's why homework is so important. I had a student that failed the class last quarter because she didn't get her homework done. Okay, she did well on her exams. She even did pretty well on the HESI, but she didn't do all her homework. So she failed the class. So homework is very important. So on Canvas, you will notice up through week 5, you're only going to see your grades for your exams and your quizzes. You're not going to see homework grades. They're not going to be, you might be able to see them, but they're not going to be calculated in to your total grade. Okay. Once we go into week 6, I'll put the homework in and you'll see where you stand with your homework. And then in week 8, I'll turn them back off again. And I will send you an announcement when I do that. So once again, your KGA, your exams, your quizzes, and your specialty HESI must equal 78%. And once we calculate the homework in, after that, it's still that your final grade still must be a 78%. Exactly, or above. If it's 77.8 and we've double checked all your quizzes and exams, we can't pass you. You have 5 quizzes in this class. Your first one is next week. Next week's quiz covers what we talk about today, as far as the content, and what we talk about next week. So I do not allow you to access your quizzes before Wednesday of the week. You have class Friday at 3 o'clock in the afternoon. My recommendation for you is to wait until the weekend to do your quiz. When you have read the material, when you have attended Zoom and you've taken notes, then you're ready to take your quiz. You can only take your quiz one time, and it is timed. It has 10 questions and you have 15 minutes. Once you start your quiz, you can't stop. You can't go back. You have to finish it. Okay, you only get one attempt at the quiz, and quizzes are important to do well on. Okay, so make sure you are prepared well before you take your quiz. We do use ExamSoft in this class. Is anyone not familiar with ExamSoft? Most everybody is. You'll take your exams during class time on Zoom with me. And I will talk to you more details about exams when we get close to the exam. So the rest of these slides are about the exams. Exams are important to attend when you're scheduled to attend class. If you don't come to class on exam day and you have not notified me within 24 hours, you get a 0 for your exam. It's really hard to pass this class with a 0 on one of the exams. Okay, you will get a 0. If there is another exam, if you have an exam in med-surg or pediatrics, you need to let me know. I don't want you taking more than one exam a day if possible. So we could set you up to take it at a different time. Homework assignments. Like I said, make a calendar. And then NCLEX questions are one of your homework assignments. NCLEX questions have to be submitted in the correct format if you want credit. We do not allow screenshots. So this slide set talks to you shows you how to do that. But I also have an announcement explaining how to do it. If you still don't understand how to manipulate your computer to save a PDF, then you need to ask me. Okay. And when your first set of NCLEX questions are due in week 3. So week 3, I'll give instructions again during class how to do it. Okay. So don't do your NCLEX questions early unless you just want to, but don't submit them unless you do well. Your NCLEX questions, you must submit 50 at one time, not 2 25s, not 5 10s. You must do 50 questions, and it must be out from the maternity category. Okay. If you do 50 questions and you get 88% or you get 44 correct, that's the score you get. Okay. So you do 50 questions, and whatever your points you get, 40 of them correct, that will be your score. Okay. You don't get all 50 just because you did them. Okay. And I do recommend that you read through the rationales of those questions. It's not required, but it sure is beneficial. When you do rationales on any exam, it helps you really understand the question and the answer. Because you can take an exam and get a question right, but not really completely understand it. So good understanding comes with rationales. Case studies, you have 4 case studies this quarter. Case studies are also a real beneficial learning tool. Your very first case study is next week, and it's on ectopic pregnancies. I posted an announcement with information about ectopic pregnancies for you, and you have your book as well. So case studies can only be submitted one time, your first attempt. There are 30 questions on these tests. If I were you, I would get your text out. They're not timed. So open up your case study, get your textbook out, and look up the answers. It's a great learning tool. You're not timed on these, so there's no reason not to do well on the case studies. Don't go in and take it and rush through it and get a 60%. It'll just drop your grade. Okay, so wait until you're ready and you have the time to put in it. Get your book out, open up the case study, and start working. One attempt, and it's not timed. So your case studies are found in Canvas. You just click on the link. There are some other assignments as well besides discussion, NCLEX, and case studies. There are HESI assignment and practice exams that you'll be doing towards the end of the quarter. And those also must be accessed through Canvas. Discussion boards. Every discussion board has a rubric of what's expected in your discussion board. Let me find one. So this is week 2 module, and there's a discussion 1 right here. This is your assignment for next week. So I'm going to open that up, and it tells you the question. The question is asking you about unintended pregnancies. 50% of pregnancies worldwide are not planned. They're unintended, okay? And sometimes that leads to a problem because if a woman is not healthy, then she's going into a pregnancy not healthy. So what can we do about it? how can we prevent unintended pregnancies? So what you need to do to answer this question is to read an article. Find an article. You can go to the online resources that you can find in your modules. You can go to Medscape. You can go to the Mayo Clinic. You can use your text. Read about unintended pregnancies and then answer the question. Okay. You need to just answer the question that you're asked. Make sure you answer all parts of the question. And then when you're finished, if you use an article, you have to put in the APA reference. And I gave some information how to do that. Okay. So this is what you need to do initially by Wednesday night. Post about unintended pregnancies. And then respond to your classmates. Respond to 2 separate classmates on 2 separate days. Okay. And already we've had some responses here on this one. So there is a rubric. Let me look here and see if I can find the rubric. No. There, let me do it this way then. Okay, so this is what I see. Can you still see my screen? Okay. So here's the rubric. In other words, this is how I grade your discussion. So it tells the criteria I need to see. If you post a submission that shows me you understand it and you answer the question completely, you get 6 points. If you post a submission and it shows that you have enough knowledge, but you really didn't answer all the question, you get 4 points. Okay, if you post and you really did not understand the question and you didn't put the right answer or put a right answer, you get 2 points or 0. Okay, and so that's the criteria I use to grade your. And so you need to make sure you submit it correctly, that you cite the source using APA, and that you respond to your peers on time, and that there's no grammatical errors. Okay, so that's how I grade the, if you need help with that, I'll be glad to help you. So that's your discussion question. And that's what that's about. So any article that you find that you know, the CDC is another great site for unintended pregnancies. Please don't put 3 paragraphs worth, just a short paragraph. Don't use a whole sheet, a whole page. Keep in mind, if you have a lot of words on a page, nobody's going to read it. Okay. And you're not going to get many responses. And that's a lot of work for me to read a whole page for every student I have. So keep it concise. Okay. No cutting and pasting, or you'll get a 0. Okay. Put it in your own words and make sure you give credit for the source, to the source. And then the rest of this are the exams. Okay. So anybody have any questions so far? I know everything's thrown at you at once, but you have a copy of this PowerPoint that you can refer to remind you about things. And then every week by Sunday evening, I will have posted the week's objectives that week, what we're going to be doing, what things are due, what you should be working on and considering. Okay, and reminders, if you didn't get something done the week before, get it done that second week so you can get some credit. Okay. So any questions? Everybody feeling overwhelmed with everything going on this week?
Yes.
Yeah, so if your classes are moving around, it can be pretty hectic. Okay.
I saw that there was exam reviews.
Mm-hmm.
Is
Mhm.
that true for the quizzes as well? Just the exams?
Oh, no, just exams. Yeah.
And what does that look like?
Okay, so what all the OB instructors have what's called a Zoom exam review. So during week 3, I will send you out, well, it'll be before week 3, next week, late next week, I will send you out a schedule. When OB instructors are having exam review, you are allowed to attend any of those. Okay, so exam reviews are not during class time, it's optional sessions. Okay, so we usually do it later week 3 before week 4, and mine are going to be on Sunday. I'm going to do an exam review on Sunday before the week of exam. Okay, all the reviews that the instructors are doing are going to be recorded, and you will have access to all those recordings. So you might find an instructor you listen to that you really learn a lot from. So you'll have access to that. So we go over the important points, the concepts that you have learned the previous weeks. So for exam 1, it's going to be covered from weeks 1 through 3. Okay, 1 through 3. And the exam is in week 4. Okay. So
Thank you.
we'll have a review session. We provide you with a PowerPoint of that session, and we also give you a study guide. Okay, so you have those tools to work with and to prepare. All right. So my job is to get the study guide out to you ASAP, so you have an idea what kinds of things you need to be taking notes on. Okay.
Thank you.
Yes, Owen, we're going to take a quick break here, and then we'll come back and we're going to go over content from chapters 1 to 3. Okay, so it is 3:53 my time. So let's do 4 o'clock. So about 10 minutes, maybe a minute after, we'll get started again, and we'll talk about content from the first 3 chapters that's important. Okay. I have here showing you your announcement list. Announcements have good information in them. So you can see you've received quite a few already. Week 1 announcement is called On Your Mark, Get Ready, and Let's Go. And this has, as you might have hopefully have seen, what we're doing this week. Okay, it tells you what you need to be reading. It gives you the PowerPoints that I use. So there's a nursing online, the one I'm using, and OB Meds to Know. Some students weren't able to access this for some reason, so I have it in a different announcement. For this week, I want you to just look up and I want you to look up your drugs in your text. And the reason I want you to look in your text, because they're specific or particular to OB. Why we use these drugs in OB. Okay, so prostaglandins, nifedipine, which is also Procardia, Tdap, and rubella vaccines. So start with those drugs and make some cards up about them, what they are, what class of drug, what's the indication, what dose, An indication means why do we give it for OB patients? What are some contraindications? In other words, why this drug should not be given to who? In other words, there's a contraindication to give certain medications to certain people, okay? And then adverse reactions. A lot of these don't have adverse reactions this week. And then attending class, complete your attestation, and then your assignments that are due this week. So you have your OB calculations. Okay, you can use your calculate with confidence text in your introductory discussion. And then I gave you 2 PowerPoints here that I'm going to begin in a few minutes here. Okay, so every week you'll get a weekly guiding announcement. Okay. OB calculations that are due Monday morning. I sent you all an email about that. So do the best you can on them, submit them. I will give you some feedback and let you correct it so that you can resubmit it at the best score. Okay. Does everybody understand you can resubmit? Even if I've already graded it, go ahead and resubmit the corrections. You don't need to submit the whole thing. Just send me your corrections on a different sheet of paper and I'll change your grade. Okay. So that's what I mean by weekly announcement. And then I put on here about WellConnect, a math help video. This is Dr. Brown's video. She goes through ways of calculating math. It's a long video, so you can kind of start it and pick out what the parts that you need. And then her announcement about schedule changes if you need to change your class to a different time. And then the ABO system, because we'll be talking about that next week. The ABO system is our blood type and the different antigens in the blood. And then, of course, the list of obstetric drugs. So that's, any questions about that?
Yes, can I ask a question? So the four drugs that you just gave us to make the drug cards, do we need to turn the drug cards in? It's just basically
No.
material for ourselves.
You're preparing for yourselves, and you'll need to do that for simulation anyway. You'll be doing drug cards for simulation.
And you
Okay.
still, we need to know can you go over what we need to have on a card? You said drug class. I kind of missed a couple of them because you were going.
Okay, what the mechanism of action? Okay, indication. In other words, why is it given to your client? What is it given for? For like nifedipine is an anti-hypertensive drug. It's a calcium channel blocker. And we give it for high blood pressure in pregnancy if we need to. And there's other reason we give it. We give it to relax the uterus. So there's more than one indication for it. And you'll see that in your text. Okay. If you go to your drug book, you're not going to find in there that nifedipine is used for pregnancy. It's not going to be in there, but it's in your text. Okay. Okay. Does that answer your question, Brittany?
Yes, thank you.
Okay. All right. I give you a lot of information in that list. When I give you the OB drug list, I've filled in some of the information. Okay. For you to save you some time. All right. Let's begin some content. So we are going to begin with talking about WellConnect again, because this is a free resource that Fortis offers to any student 24/7. If you're to the point where you're pulling your hair out or something has occurred, some kind of traumatic incident during your education, this is one resource that you can call and talk to somebody. It's very beneficial and it's free. Nothing like free beneficial resources. So let's talk about the role of a nurse. What do we do as nurses? We take care of people, right? Most of you in your introductory said you just want to take care of people. And that is a noble cause. So how do we do it? How do we think about do it? What are the things that we need to do to meet the needs of our clients? So when you look at Maslow's hierarchy, if you've never heard of Maslow's, it's a hierarchy developed based on our most important needs. And the basic need that we have as human beings is at the bottom: food, water, warmth, and rest. If we don't have these, there's no sense in trying to meet the other needs. If you have a client with sepsis, why do you want to talk about feeling of accomplishments? No, they need IV medication, they need warmth, right? That's more important. So that's where you're focusing. Once they have all of those things met, then we need to think about safety and security. Okay, so as nurses, we're focusing mainly on those very basic needs at the bottom of the hierarchy. Okay, that's what we do as nurses. So we learn how to prioritize what's important for our client at the time. If you have a postpartum client and the #1 cause of mortality during the postpartum period is bleeding, hemorrhaging, you're not going to worry about walking in the room and doing a complete neuro assessment when you know that she could die because she's hemorrhaging. So our focus for postpartum is the fundus. It's a physiological need. Okay, so that's our priority, the fundus. Not the breast, not the legs, not the heart, not the lungs, but the fundus. And then the nursing process. This is a process, a model of how we think as nurses. And every state in this country requires that you use this in your practice. It's a law. You have to use the process. It's a way of getting information, using that information to make a plan for the best outcome for your client. Put it very simply. So the assessment portion, you have assessment, diagnosis, planning, implementation, and evaluation. It's also known as ADPI. Okay. Assessment is collecting information. So you read the chart, you read the labs, you read her history, you talk to the client, asking them questions, you physically assess the client. That's how you collect information. That's your assessment. So with that information, what do you see as a pattern? So we have example, we have a client that's being admitted to the hospital with preeclampsia. So we read about her history, what's been going on with her blood pressure and her edema in her urine. So her needs statement is that she's at risk for injury because of the risk of seizures. Okay, that's our diagnosis. So our planning is going to be preventing seizures, preventing seizure activity, and promoting health. Okay, so seizure precautions. We're going to implement seizure precautions. Okay, and there's other things that we want to implement, but seizure precautions is one thing. So we're going to have suction that works in the room. We want to make sure oxygen meter is working, the wall access is working. We want to make sure the side rails are padded and they're up. We want the bed down. That's what we're implementing. That's what we're doing. And then we're evaluating by saying, well, she has a seizure, unfortunately, but she was safe. because we had everything in the room in case she had a seizure. Okay, so that's how we use the nursing process. It takes time to begin to grasp what that means, but we will talk about it this quarter in certain situations. I'll remind you of the nursing process. And then let's talk about some terms that your textbook talks about so that you understand evidence-based clinical decision-making. You make a decision based on what you know to be as true by research, not by, this is the way Fortis does it. This is the way Cleveland Clinic does it. Well, although Cleveland Clinic is a research-based hospital. Or not, so-and-so does it this way, so we should do it this way. No, we make decisions based on what we know evidence is, not on opinions. Well, my mother told me that they did this. I heard that anytime a woman begins to have sexual activity, she needs to have a pap smear. Well, the research doesn't show us that. Okay, so anybody have an example of something that could be an evidence-based issue? The way you do something, is it really proven by evidence and research? Anybody have anything at all they can think of?
Something that just popped in my mind was, I guess, vaccines linked to autism in children.
Okay, so what do we know about, what does the research show us about that? That's a tough one.
Yeah, I don't know. I'll get back at you with that.
Yeah, we have to look at, the percentage. We have to look at the source. Is the source reliable? What kind of a source is it that, if they do one study, that's not a good enough reason to make a clinical decision. But I can share with you one about, and it's on the screen here, it's about pap screening. So a GYN provider that performs pap smears on someone younger than 21 is not following the evidence. Okay, it's still being done. Providers still do pap smears on younger people every year, but research shows us that it's not necessary and there's more trauma involved than benefit. So the guidelines written by research organizations tell us that it's not necessary to do a pap smear on a woman before she's 21 years old. Okay. And if she's never had intercourse at 21, it's not even necessary. Okay. I've had clients who come in for exams and they're mentally, developmentally delayed. They've had some damage to their brain, or it didn't form correctly. So these women have never had intercourse. I don't do pap smears on them. But a woman at 21 who's had intercourse needs a pap smear. And a pap smear, all we're doing is removing some cells on the cervix to see if they have abnormal growth. Okay. If they do, then we're going to follow up with another pap smear at a shorter amount of time. Okay. Why do you think we don't need to do it before 21?
Is it because our bodies clean itself?
Yeah, basically, that's right, Charmaine. Our immune systems younger than 21 are able to destroy that virus that causes cervical cancer. And that's the HPV, the human papilloma virus. It's the culprit for cervical cancer. And even if a woman is sexually active and contracts HPV, if she's younger than 21, her immune system can destroy it. Even really up to the age of 26, Okay, so guidelines say we don't even need to test for the HPV itself before the age of 26 to 30. Okay. So that is, you need to know about the age of pap smears at 21. Okay. If a woman has had intercourse and she's contracted HPV and she's 24 years old, it can begin to damage the cervical cells and lead to cancer. Okay, but we don't usually see cancer that young. Okay. But we do begin to do the pap smears to look at the cells at age 21. So that's evidence-based. The provider I worked with in the for OB, he did pap smears on every woman that came in pregnant, no matter what their age, no matter when they had their last pap smear, and that does not follow any guideline. I didn't. If it'd been 3 to 5 years, if they tell me their pap smear was normal, and if it'd been more than 3 to 5 years, I would do one, but not if they were younger than 21. I just did a culture check for infection. Standard of care. Taking care of your clients at a high standard. Example, a young woman is looking for a boyfriend. Okay, she has certain standards. If he doesn't like football, if he doesn't meet that standard, she doesn't want to go out with him. Okay, that's a standard. An example. So as a nurse, you have standards that you need to meet. Okay, in other words, you are practicing safely in a way which another nurse who practices safely in the same situation. Okay, if you are not practicing according to standards and your patient is harmed, you're negligent. Okay, or if you don't do something you should have done, you're negligent. Okay, so if you need to perform a procedure on your client and you really don't know how to do it, or you don't feel confident, don't do it. Ask someone else to show you and train you. Okay, make sure you stay within your scope of practice. Don't do things you've not been trained for or you're allowed to do. If you don't know for sure, you're at a facility working, look at the policies of that facility, look at the protocols. Sentinel event is an event that is not due normally, something that doesn't occur naturally. We don't expect it to occur, but it occurs and it causes death or permanent injury, even temporary injury or harm. It's called a sentinel event. Has anybody ever experienced this? Those of you who've been in healthcare, experienced any kind of event that wasn't expected?
I haven't actually experienced it, but I do know, like, I'm currently a nurse right now, and I know of a facility that I was working at where a nurse gave too much insulin, and it made the person go into a coma, and then resulting they died from having too much.
Oh, yeah, that definitely is sentinel event. It's negligence too, isn't it?
Yes.
Yeah. Oh, wow. Okay. That's a good example. Okay, failure to rescue just means that your client is behaving or showing certain signs of distress and you fail to rescue. You don't intervene. What's informed consent?
Like walking in the room and telling the patient what you're about to do before you perform what you're going to do, maybe like an assessment, Foley placement, something of that nature.
Okay, so that's good to do, but an informed consent is really referring to an invasive procedure where you have to get their permission in writing So a written informed consent. In which situations can anybody think of that we would need a written informed consent?
A blood transfusion?
Blood transfusions, we have to get their permission. Why do we have to get their permission?
Because we're giving them blood from somebody else and something can happen.
Mhm, exactly. Yeah, so they need to know the informed aspect of it. They know the risk associated with what you're about to do, and they give you permission. So an informed consent means that they are signing, they understand the procedure, what's expected, why we're doing it, the risk associated with it, and they say, go ahead and do it. That's what we mean by informed consent. So blood transfusions, surgery, okay, paracentesis, thoracentesis, epidural insertion, bone marrow aspiration, those invasive type procedures, we need permission. Okay, human trafficking, your book talks about, you won't be tested on this, just some good information. Human trafficking is about slavery. Okay, slavery to labor or to sexual acts, things such as that. It's illegal. It's a real problem in the world. Okay, so learning about it and making this information available, and posters in your facility is very important. So I just given you information on websites with this information that you can read about so that you're informed, so that you can educate your clients. So if you witness something, remember, you can't save them or fix the situation without professional help. So protect yourself first. If you're in a situation, remember, you have to take account your own safety. Okay. So these are just some guidelines. You're not going to be tested on this either. Intimate partner violence, though, we do want you to know something about, because during pregnancy, domestic violence increases at least 20%. And often it's the first incident. If you think about it, when a man and a woman come together and they conceive, they have a relationship. When they conceive, that relationship changes. Now they have a third person involved. So if they're not prepared, if the pregnancy was unintended, that relationship could become very tenuous. In other words, tension could build in the relationship because of the pregnancy. That's why sometimes we see an escalation during pregnancy if there's a history of intimate partner violence. Okay, it's a physical violence, a sexual violence, some kind of physical harm that occurs. What are some signs that a woman is being abused? Anybody have any ideas? What are some things that you might see?
Bruises.
Okay, bruises in places you wouldn't normally expect to find them, on the abdomen, on the back.
Like the woman being shut down, like when being asked questions, they kind of look down, look away, don't make eye contact.
Very good. Yeah, withdrawn. Yeah, very shy, withdrawn, reserved. Doesn't want to give eye. Yeah, that's good.
Change in like the demeanor when the partner's around.
Oh, that's really good. So how does the partner behave?
I guess very
Like the woman or the
One who's who not your client, but the other person who's abusing.
Maybe dominant, maybe wants to talk over that person
Exactly.
for questions for them type thing.
Yes, yes. So in your textbook, because you will be asked these questions on the first exam, signs and symptoms. Okay, in your textbook, there's a chart about signs of abuse. So make sure you check that out. Then there's another website, Office of Women's Health. And by the way, Office of Women's Health is another website you might find articles in. And I think if you just searched on Google or whatever, Office of Women's Health, it'll take you to it's a government website. Female circumcision is another phenomenon, I might say, or practice in some cultures, not in the US. It's illegal here. It's another term, genital mutilation. But you need to refer to it professionally as female circumcision. It's a removal of all the external genitalia of a female, parts of it or all of it. It's done in different manners. Some cultures, this is what they practice, and a woman born and raised in that culture expects it and doesn't think anything of it. So we have to be really careful how we approach these women. And the reason it's brought up in this class is because if you do an exam on a woman, you might notice it. So you need to be aware of it. And also, if we take in a woman for a prenatal visit and she's had female circumcision, we need to make plans for labor, because if they've had a lot of surgery, there might be a lot of scar tissue and she might not be able to deliver vaginally. So planning ahead is important. Okay. So you can read about that. You're not going to be tested on that either. But you need to know what ethnocentricity is. Ethnocentricity, centricity. Okay. So it's a negative connotation. In other words, when you hear the word ethnocentric, it's not good. Okay, it's not good to be ethnocentric. If Charmaine was ethnocentric, Charmaine has certain values. She has certain beliefs and traditions. And if she's ethnocentric, she thinks that all her clients ought to have the same values and traditions and practices that she has. As nurses, we can't be that way. We need to consider their cultural desires and beliefs and values. If their culture, they wear a certain garment during labor, we need to address that. We don't need to say, nope, you got to wear a hospital gown. No, we don't. You don't have to wear a hospital gown. Okay. So being ethnocentric is being very self-centered. My values are more important than yours, and you should change. I know what you need, so you need to do what I say. That's not being very nice to begin with. You know, I would never say that to anybody, but as a nurse especially, you're not going to say that. So ethnocentrism is negative. Can anybody else think of a way someone can be ethnocentric in a patient situation?
Like Jehovah's Witness, they don't believe in blood products. So by pushing them to receive the blood products, it's like, this is my belief. If you don't receive it, if you don't take the blood products, you're gonna die.
Yeah.
That's their religion. That's what they believe in.
Okay. But it's good to bring it up, because there's other things that we can do besides give blood. But it's good to be willing to talk about it. But yeah, you're right, Carrie. You're right. Yeah. Anything else?
Maybe like praying. A lot of patients don't have the same belief as to praying. So when you have a patient going through something really negative, that's really bad news, maybe on the verge of passing, and you as the nurse push prayer, that's like ethnocentric, because you believe their prayer works, but what if they don't? It could become negative.
Yeah.
Very offensive.
Yeah, that's good. Yeah, that's good. Do you know what do you call it if, let's say, in a situation I was getting ready to start an IV in someone. I had an order to do an IV, and I started the IV, and the patient said, "No, I don't want that." And you were if I was very coercive and said, "Well, I know you don't want it, but you need to have it. The doctor ordered it and you put it in anyway." What do you call that?
Is that malpractice?
Abuse.
It's called battery.
Oh.
It's called a battery. Yes, it's a form of abuse. Yes, it's called battery. A patient has a right to refuse, but you need to use your skill, your people skill, to explain to them the benefits and the risk of not choosing it. Okay. Review your female reproductive system if you're not familiar with it. Ovary, fallopian tubes, the top part of the uterus is called a fundus. The uterus is a smooth muscle. That's where the fertilized egg implants. Fertilization takes place in the fallopian tube and in plants. I gave you and you'll get it this weekend, a quick fact sheet about embryology, just about fertilization, implantation, and that sort of thing, because we're talking about it next week. The cervix and the vagina. So hormones change all those things. Okay, a couple terms. Thelarchy is the first sign of puberty, the development of breast buds, and usually during pregnancy, progesterone and estrogen levels are very high, so breasts are very tender during that time. Menarche usually begins 2 years after thelarchy. Okay, so there's usually a 2-year delay there. I talked to you about the uterus already. Hormones, this is just a chart of what they do. And we'll be talking about in more detail as we go through the course. You'll be learning about the different hormones. So estrogen and progesterone. Progesterone is our maintenance hormone. We need high enough progesterone levels to get pregnant. And that level needs to climb because it supports that growing pregnancy. Obesity prior to pregnancy puts a woman at high risk. Number one, she might have trouble getting pregnant. She might have trouble with miscarriages. If she's able to keep the baby and she gets to that 20-week magical week, she at risk for developing diabetes during pregnancy. And we call that gestational. Preeclampsia, preterm labor and birth, labor dystocia, and then her baby can have problems with respiratory distress. You need to know the normal BMI. Normal weight BMI is 18.5 to 24.99. Obesity begins at a BMI of 30. So what's the percentage of adults in this country that are obese? Does anybody know?
Isn't it around like 60% or something?
Not quite, 33%. 33%. It's probably headed in that direction though, Abigail. Okay, so screening. When we talk about screening, we're talking about just general information to get an idea if there's a problem. Let's screen. We're doing a Pap test to screen for possible development of cervical cancer. Okay. When we do a Pap smear, we have to instruct the woman not to put anything in the vagina the day before. It might affect the outcome. Okay. And then the human papillomavirus we talked about, that's the virus that's going to cause cervical cancer. There's like 100+ strains of this virus. Okay, some of the strains just cause warts. It doesn't cause cancer. Not all of them cause cancer. Okay. Any questions about any of that? Okay, let's move on to the next slide set. So let's talk about health promotion. Assessment and promotion. So we're thinking big picture here. So we have a woman that's not pregnant. We still need to do wellness type checks, annual checkups, just like any other adult, annual checkup, screening, cancer screening, colon cancer screening for cholesterol for an adult, screening for diabetes, things like that. So for a woman, we're screening for that plus breast cancer. We do a breast exam. We do pap smears. We do blood work to screen for things. And for pregnancy, we screen for things a little differently. We screen for possible syphilis. We screen for genetic disorders by blood, using blood, and collecting a family history. So that's what we mean by promoting not only screening, but promoting health. What should a woman be concerned about when she's in her reproductive years? Well, number one, does she want to get pregnant? Is she sexually active? If she doesn't, then what birth control is she using? Or is she? What are her options? So we've talked a little bit about puberty, what it is. I think the average age of the first period is 11 years old, and perhaps younger, 10, 9, 10. Sometimes a woman will have her first period. Please don't memorize the cycles in the book, the endometrial, all that physiological stuff that is not really necessary for you to know at this level. Okay. Menstruation, the first period. Prostaglandins are that class of drugs that you're looking up. Prostaglandins are basically hormones in the body. They're found in every tissue. Okay. They're released at high levels during labor, and we don't always know why. We're thinking the fetus might be what stimulates the release of prostaglandins. So they're endogenous. We have them naturally. But we can also prescribe prostaglandins, in other words, exogenous drugs. And we use prostaglandins during or prior to labor to soften the cervix. Okay. So prostaglandins do a lot of things naturally. They help cause ovulation. They help with tubal motility, the fallopian tubes, help with fertility itself, and stuff, all kinds of stuff. So menopause means a woman has not had a period for a year. Okay, average age is 51 around the world. And then your book talks a lot about barriers to health. You hear about poor access. Well, there's different ways that we can't access. It's not only physiological access, or I should say physical access, not being able to get to a healthcare center, but not having the means to get there, not having the transportation, not having the money, don't have a job, don't have insurance, don't know I need to go. So education. I don't know I need to go when I'm 21 to get a pap smear. Nobody ever told me that. And I think of people who live in the rural community way out, who don't have a lot of interaction. They don't know these things. Cultural issues with barriers. We do certain things in this country or in our American culture, our American healthcare system routinely. And if you come from a different culture or an area of the world where that's not practiced, then you don't know you need to do it or you should do it. for your health. Like people, I had clients from the Middle East. They don't do routine pap smears in the Middle East like we do here. And so, and yet their society, we don't see a high rate of cervical cancer either. Okay, so there are cultural issues. Language, they don't understand what you're saying. I had, I don't need to go in that because it doesn't have anything to do with barriers. Okay, so there are barriers to healthcare, just not knowing what you don't know, for one thing. Okay, caring for women across the lifespan. So this has to do with prevention and promotion. Disease prevention is about promoting a lifestyle that helps to prevent disease, but we can't always do that because of genetics. The group that we're most concerned about in this class are the adolescents. If we have an adolescent, a woman under the age of 18, that presents to us with a pregnancy, usually it's unplanned, is considered an adolescent pregnancy, and they're at high risk just because of their age. And the reason is that they're not physically grown yet. There's a lot of demands on their system because they're growing. If you superimpose a pregnancy on that, then the demands are even greater. So chances are nutrition's not going to be adequate. She might not have good habits. She might not even be taking vitamins. So we're most concerned about an adolescent gaining enough weight during pregnancy. She's going to be at high risk to have a smaller baby, a low birth weight baby, because of nutritional deficiencies. So we have to make sure she's on prenatal vitamins, extra iron, extra folic acid during her pregnancy. And then after delivery, we have to talk about contraception. She needs to wait a while before she gets pregnant again. So we need to talk about those things. Okay. So women who are at risk, besides our adolescents, are women women who are above 35. They're considered high risk because their eggs are 35 years old plus. Okay. Social risk, cultural, genetic. What if she carries an abnormal gene? What if she's a carrier for sickle cell? Is her partner a carrier? Those sorts of things. She's at risk. So if she and her partner carry the sickle cell gene, then the risk for delivering a baby with sickle cell is 25%. Okay, so we need to be aware. So we do genetic screening during pregnancy. That very first visit, we draw blood and do genetic carrier screening. Substance use. What is she eating? What is she drinking? What is she using as far as drugs? We're talking about prescription drugs as well as illegal drugs or street drugs, cannabis, methamphetamines of any kind, heroin. The opioid epidemic caused the cheaper, more available heroin. And so I saw some of my clients buy heroin. They couldn't get their opioids. So they went, well, heroin is an opioid, but they went to the streets to get it. So we need to know those things. Alcohol consumption. We don't know how much alcohol a woman has to drink every day to damage her baby. So the general rule of thumb is no alcohol, to totally abstain from alcohol. Nicotine or cigarette smoking or any kind of nicotine use, nicotine gum, a patch, anything that puts nicotine in her system is something we need to know about because nicotine causes blood vessels to constrict. And these women are going to have smaller babies and they might have respiratory problems when they're born. Caffeine, one serving, 120 milligrams of caffeine a day, no more during pregnancy. And some places you'll read no caffeine. That's kind of hard to go by. Because if you've got someone who's used to caffeine, if they eat chocolate, they're getting caffeine, right? If they drink tea, coffee, Coke, Pepsi. So those are identifying, we need to find out this information early in the pregnancy, if not before. So I've talked about nutritional problems already. We need to make sure we ask questions about any kind of eating disorder. Other risk associated with our clients other than stress. It really does. When you're stressed or you're anxious, you know, you've got your catecholamines being circulated, your norepinephrine, epinephrine, it makes you hyper and nervous. If you've got that going on, it diminishes the growth of a fetus. Mental health situations. So if you have a woman that's using substances, cannabis, heroin, methamphetamines, cocaine, any of those, you can usually bet on they have some kind of depression also. That is based by research. I'm telling you that based on research. Okay, they're usually concomitant. Okay, so assessing, screening for depression is another thing that we need to do. Sleep disorders, hazards they're exposed to with their job or their living situation. What if they're secondhand, if they're exposed to secondhand smoke? High risk sexual behavior is basically having more than one partner. And then female circumcision. And we talked about violence against women already. Emotional or physical abuse, sexual abuse, isolation, somebody controlling everything about a woman's life. I had a client, she wasn't being emotionally necessarily abused or even physically abused. Her husband was just very controlling. He only let her spend so much money, only allowed to leave the house this time, only allowed to spend this much time with a person, only allowed to buy this much. Very controlling, very controlling. So when we talk about the intimate partner violence, you do need to understand about the phases. And this is what research has shown us, that intimate violence, violence between intimate partners during pregnancy goes up. Okay, it escalates. And usually that relationship we talked about, tension builds until it gets so bad that the partner, one will abuse the other. And in pregnancy, we're talking about the male against the female. But as you know, intimate partner violence, it can be the opposite. A female can abuse a male. Okay. But for this course, we're talking about the female. So the male is the one that's being abusive, because the tension has built up to the point where he can't take it anymore. And the abusive incident occurs. So that's a phase 2. After that happens, there tends to be a honeymoon phase where the abuser will be very apologetic and really mean it. Okay, very apologetic and promises change. But because if that tension isn't released, it'll build up again. And someone from the outside has to help them. So it's a cycle. And we need to make sure our clients that we suspect know that it's a cycle. So battery during pregnancy, I said 20%. This slide says 30%. It might happen for the very first time during pregnancy. So here's a screening tool that's in your text that's used often for our clients. And because you're the nurse, you have a relationship with your client, very direct, because you're their advocate. You need to ask very direct questions. Are you with a spouse or a partner who threatens or abuses you? Do you feel safe? Do you live with someone who hurts you emotionally within the past year? So these are basic questions. There's only 5 of them here that you can, in fact, it might be in some of the computer software at the hospital or in your clinic. So let's finish our time today with a question. I want you to read this scenario and I want you to answer in the chat which one you think is correct. This is so interesting because my class earlier this morning, everybody chose B. This class, everybody chose A. So what do you think? I want to pick on somebody. Somebody decided they're going to pick B. Who was it? Is that you, Gabrielle? You're muted, dear. Unmute yourself.
I'm
There
sorry.
you go. Why did you choose? You're the one that chose B, right?
I did. And
okay,
I was laughing at everyone else putting that, but I picked B. So I picked B because yes, you want to protect the client, but in my mind, it's just you're putting it out there like this is what you can expect. If this is what you're going through, you know, these are what you can look for, but you know, you're saying no, but I'm seeing something different. So just like an awareness.
Okay. She's right. B is the correct answer. Yes, it's the nurse's ethical responsibility, but it's also your responsibility to make your client aware. Okay. We go one step farther because remember, it's about health prevention and promotion. Okay. We're looking out for our clients. So educating them. Yes. Okay. So you're denying that there's a problem, but I can tell you, let you know that if it is a problem, if it does become a problem, it tends to be a cycle. And unless somebody helps you, it's going to continue over and over again until you get some help. So yeah, we have to educate and inform our patients, our clients. Okay. All right. I am finished with my part. Is anybody have something they want to say or ask?
Where could we find the recorded Zoom?
I am going to put the recording in with on your mark, get ready, get set. Okay, in that announcement. I'll put it at the top. Okay.
Is that today's recording?
Today's recording. Every week I will post the recording in the same announcement where I give you all your other information.
Okay. Awesome. And I had a question. On the question that was asked, what we just did, I didn't choose B because we're taught to think safety, right? So the ethical responsibility to protect the client stood out more than the cycle of violence. And I don't know if that was everybody else's thought.
Okay,
The cycle of violence would have been my next choice, but it just seemed more to answer that question would have been the safety of the client. And I think it's probably why everybody chose A.
okay. Yeah, it's always, it's either one or the other every quarter, you know, that's how we think. But I think the purpose of doing this question is to show you how important it is to go one step farther.
Okay.
And learn that health promotion.
So if this was a NCLEX question, would it have been wrong? Question, the answer A?
Yep.
Okay.
That's why once you answer it and if you realize you got it wrong, what does the rationale say to you? What does the rationale say? Rationale says it is a nurse's job to educate and inform the client, to promote health, prevent disease. Okay.
Yes, ma'am. Thank you.
Yep. You're welcome.
Do you
Okay.
post your PowerPoints?
Yeah, they're in the get on your mark, get ready, get set. So every week there's an announcement and I'll label it week 1, week 2 from now on. Okay. So week 2, in fact, I already have it ready to go.
Okay.
Week 2, it says what's going on during that week and it gives what's due. My PowerPoints or any documents I send your way are going to be in there. And then once we have our class, I put the recording in that same announcement.
Okay.
Okay. You can, if you can't find it, just send me an email or text. Where is it now? And I'll tell you. Okay.
Yes, ma'am.
All right. Well, you all have a good weekend. You can shoot me a text. Let's see. I was thinking safety first. Okay. Yeah.